Hello, everyone. Thanks for joining us on the media briefing for this Wednesday. We'll get started. We've got a late addition to our lineup. We're very pleased to have Kim Stemler from the Monterey Vintners and Growers Association join us to talk about a new webinar that you've got coming up in collaboration with Natividad. Tell us more, Kim.
Yeah, so let me quickly give you the little flyers in the chat. Sorry, I should have done this before. What we were hearing, we actually have over 25% of the ag community vaccinated right now. It's probably more like 30 to 35%. And what we were hearing is that although most people want to get vaccinated, there are some employees that are very hesitant. And that's because they believe erroneous information, and who knows where they're getting that from. So we've come together with our great partners at Natividad Medical Center, and two doctors will be hosting a clinic. And I just put a link to both the PDF and an image if you want to use it. We'll be hosting a webinar for all employers in Monterey County, and it could be outside of the county, just an hour long, 2:30 on Thursday afternoon. It's free, open to all employers. And the doctors will go through some of the common myths that we're hearing and clarify what's fact and not fact. And then employers, particularly HR staff, will be involved. They will be able to ask questions of these doctors and get those myths that they're hearing on the ground, get great answers to them so they can share those answers with employees. And that's it. Mia?
Oh, I'm mute challenged again. So if you could give us the time again tomorrow at 2:30.
Tomorrow from 2:30 to 3:30. And if everyone can see the chat, right?
The people on YouTube and Facebook cannot.
Oh, okay. So it's from 2:30 to 3:30. And it actually, you know what? Can we share this on your social media?
Yeah.
Ma'am?
Yes.
Okay, we'll get it shared on the county social media. We'll reshare it. We know that the chambers are sharing it. So we'll get it out on social media so you know, because you need the address of the webinar to be able to attend.
All right, thanks very much, Kim, and thanks for joining us kind of at the last minute to share this information.
Yes, thank you.
And we're going to move on to our next topic, which is funeral assistance from the Federal Emergency Management Agency. A lot of people are in need of this service, and FEMA has come through with some assistance for residents, and we've got staff from the Monterey County Office of Emergency Services to tell us more about that. Justin Lynn, who is an emergency planner, and Gary Millay, who's our emergency services manager. Hello.
Hi, how's everybody doing?
I think we're good.
So I'll just jump right in. So, we're very sensitive to the losses that have happened within our communities due to the pandemic. So our goal is to support community members that are eligible and interested in applying to FEMA's Funeral Assistance Program. So here are the key things you need to know. The program starts in early April. A specific date hasn't been released. It's a no-cost program. And the reason we're mentioning this is because FEMA's been alerted that there's scammers reaching out to people offering to register them for funeral assistance, and FEMA has not sent out these notifications. They don't contact people before you register through the phone. The assistance is limited to a maximum of $9,000 per funeral and a maximum of $35,500 per application. So that may cover multiple funerals. This means if you incurred costs, you can apply in a single application for multiple funerals. The process will only be accepted first through the toll-free 800 number, which hasn't been released yet, but like I said, it's coming in early April. And it's going to be in multiple languages and TTY for the hard of hearing. The FEMA website will have the most up-to-date program information, and Maya, thank you for sending that out later as a press briefing, and it'll be in Spanish and a few other languages. Just really quickly for eligibility, there are 4 key criteria. The death must have occurred in the US, also or in the US territories and the District of Columbia. The death certificate must indicate the death was attributed to COVID-19. And I'll talk a little bit more about that in the documents where there's specific language that can count. The applicant must be a US citizen, a non-citizen national or qualified alien who incurred funeral expenses after January 20th, 2020. So it is a retroactive program. And the fourth thing is there's no requirement for the deceased person to have been a US citizen, non-national citizen, or qualified alien. And this is just direct language from FEMA. For a quick overview of the documents, you need an official death certificate that attributes the death to COVID-19 indirectly or directly and shows the death occurred in the US. The certificate must have phrases like the death may have been caused by, or was the likely result of COVID-19 or COVID-19-like symptoms. Similar phrases will be accepted. So you do need a call. They'll be able to provide the information. You'll also need funeral expense documents. This could include the applicant's name, the deceased individual's social security number, or other information, the amount of funeral expenses, and the dates they were incurred. Finally, proof of funds received from other sources specifically towards funeral costs. This can include insurance, and they just want to make sure you don't duplicate benefits. Locally, we'll have the information on the OES website, and people can reach out to OES through info.oes@co.monterey.ca.us, our email. 211 has also been given this information, and they can refer people directly to the FEMA line once it's released, or us. And as I mentioned, the website's going to be the best place. The FEMA website will have the most up-to-date information. That's it from my end.
Thank you very much, Justin. And I know we've got some questions coming in, and we're going to go ahead and finish with all of our other presenters and then get back to you with some questions. I know there's some for you already. Thank you very much, Justin. Now we're going to move on to our community health worker topic. And we're pleased to have Michael Castro from the Community Foundation for Monterey County and staff from our health department, Chris Tahani, and staff from our CAO's office, Rosemary Soto, to talk about the launch of the VITA program. Hello, ladies and gentlemen.
Hi, how are you?
Good. Welcome to the briefing.
Good afternoon, everybody. I'm Rosemary Soto with the County Administrative Office. We came to you with the information, and you've heard of the Community Health Worker Project, which began in early December as a pilot project and then was awarded a significant contribution by the County Board of Supervisors for its expansion and full implementation to increase our reach into the community. At this point, we are here to formally announce an official name for the project, which arrived through a collective process with all of our community partners. And we're proud to name this project VIDA, which is an acronym for Virus Integrated Distribution of Aid. And in Spanish, the word vida means life. So we feel that it is very much aligned with the mission to help and support our community members who are most impacted by the pandemic and COVID-19 directly or indirectly. And so to date, we have hired 110 new community health workers that are assigned to different parts of the county, not only to provide outreach and information to us, but to also assist with the wraparound services that would help individuals and family members with their needs in terms of quarantining and adequate isolation to recover from COVID-19. This is a partnership that continues to grow through the County of Monterey's Health Department, our office, the County Administrative Office, and the Community Foundation. The Community Foundation is the grant maker to the community-based organizations who are participating in this project. And we have 10 participating organizations. In the next slide, we'll see the list of our partners. We have Building Healthy Communities, California Rural Legal Aid Assistance, and so on. And you can see the list and the contact information. And the next slide. We would also like to share with you a bit about the community health worker perspective. And for this, I'm going to go ahead and turn it over to Andrea Diaz-Aquino, who is our program coordinator with our partner CBDIO, Centro Binacional para el Desarrollo Indígena Oaxaqueño. So Andrea, if you'd like to join in and share your perspective from your role in the organization.
Yes. Hi, Rosemary. Hi, everybody. Thank you, Rosemary. My name is Andrea Diaz-Aquino, and I'm the Vida CHW coordinator for Centro Binacional para el Desarrollo Indígena Oaxaqueño, CBDIO. My role is to work alongside Indigenous community health workers in Monterey County. Our Indigenous community workers come from the communities we serve and are bilingual or trilingual, speaking their Indigenous language, either Mixteco, Zapoteco, Triqui, Spanish, or English. CBDIO's Vida teams gets to support the Indigenous farm worker communities across the county, as we know that even before the pandemic, our community lacked access to culture and linguistic information and services. For this reason, the Indigenous farm workers community has been disproportionately impacted by the pandemic. Research done in the Salinas Valley tells us that Indigenous farm workers who speak their Indigenous language are more likely to get infected by COVID-19. We note that this is due to the overcrowding housing, lack of information in their language, and accessibility to COVID-19 services and resources. Our goal with Vida is to ensure our community is getting the information in the language they feel comfortable and for people who understand them. Our team has been trained to provide wraparound services for people who have tested positive and to provide information around COVID-19 prevention. Promoting that our community gets tested, education around the vaccine, and supporting them to get registered for the COVID-19 tests and vaccine. Since we started working, we have come across community members that were not getting the right information about COVID-19. For example, we encountered a family which we were a close contact to the father of the household who tested positive. Many myths were going around in our community regarding COVID tests. One of them was that the test hurt, and medical professionals would admit you to the hospital without consent. For this reason, the father in this case refused to get tested and refused to get a medical attention, even though they presented very severe COVID symptoms. There are many more similar stories to this one. Our work is more than ever important to our community as it would change health outcomes. We know that none of us were ready for the pandemic, and it has taken a toll on our mental health, and for many members in our community, it has been deadly. But initiatives like Vida show that in times of crisis, government and community needs to be working together. CBDIO appreciates the leadership of the county, and we hope that together we can continue to work on a more equitable recovery for all of our communities. This is a step forward in the county to ensure that our Indigenous communities are being served, and we're happy to be part of this collective effort. Thank you.
Thank you, Andrea. And now I will invite Krista to share some information about the impact of the project so far.
So part of what the work that we're doing is about how these community health workers really are those change agents in the community. And we want to make sure that they are resourced effectively to be able to convey all that information that Andrea was mentioning. So we've done quite a bit of training with them, and we have resource binders essentially with the training materials and a variety of other materials, and we're keeping that up to date. For example, they also bring to us the needs of what they're hearing. And we have weekly meetings where we're hearing about those needs and then working with our project to ensure that we're trying to get them the materials that they can then get that information out and connect people to resources effectively that are needed to help them to isolate and quarantine, or to just help with other challenges that they're facing. So I thought it was really interesting that we started today with the information on the FEMA funeral replacement funds that are available, because we'd heard from our community health workers on that being a real significant need that families were facing, and the economic challenges that having had a loved one die and then having those funeral expenses. So that's just a really great example of sort of the circle of effort that's happening here to have impact in the community and to support people. And as the word spreads, the community health workers, besides being out in the community and at events, they're also now getting called by members of the community as the word then spreads about this as a resource. Already by March 1st, they were reaching up to 1,700 people or more a week. They're at testing sites. They're also doing those personal visits, putting door hangers out and doing follow-up calls for many of those people, or those people are calling them for follow-up calls to get that support. They've helped people register for vaccination appointments and testing appointments. They've helped people with isolation and quarantine. A big part of that, people just need a bit of help quite often with food because they've tested positive. They want to isolate, but they know that they need food for them and their family members. And so the community health workers have connected with the various food bank opportunities and as well have gone out and gotten supplies. And then importantly, where are they focusing? So we heard that it's the communities that they come from. They come from all our communities, but in particular, the Healthy Places Index zip codes in the county. Certainly people, if they reach out or reach out to them or from other zip codes, they will help them. But we're also looking at where our case rates were higher, where our vaccination rates potentially have been lower, and really trying to improve the vaccination rates and keep case rates down now that we've got case rates down in those Healthy Places Index zip codes.
Thank you, Krista. And Michael, I will go ahead and turn it over to you to just share about the funding.
Thank you. I'm Michael Castro from the Community Foundation of Monterey County. In December, the Monterey County Board of Supervisors approved the $4.9 million Community Health Worker Program to reach residents most impacted by the pandemic. The VITA project has also been supported by additional funds for the Community Foundation for Monterey County. Outside agencies have recognized the importance and urgency of the project and it provided additional support. Together Towards Health, which is a program of the Public Health Institute through funding from a group of philanthropic organizations, and the David and Lucille Packard Foundation as well. Next slide. The David and Lucille Packard Foundation support will help further the group's work to alleviate COVID-19 cases in Latinx, immigrant, and farm worker communities. These funds will really deepen the coordination among the local leaders and organizations around COVID-19. They'll support coordination across multiple sectors, enhance communications for harder to reach populations, and provide funds for key partnerships to really scale vaccination clinics for these targeted populations. All of these efforts really just come down to local communities having equitable access to testing and vaccine distribution. Irene Wong from the David and Lucille Packard Foundation has written a blog that shares their thoughts and hopes regarding this funding. And you can view it by clicking on the link below that we're sharing. Next slide. And here we have our contact information, our email and phone numbers if you have any questions or want to reach out to us.
Thank you, everyone.
Thank you,
This concludes
Rosemary.
our update. Go ahead.
Thank you, and thanks for bringing everybody together in this nice group. I appreciate it. We have some of our folks from OES have to drop off the call, so I wanted to take some questions about the funeral expenses right now before they had to leave. So Justin and Gary, is Gary still on? He may have. There he is. Okay. All right. Thank you. Let's go ahead and do those questions. Sorry to take things a little out of order, but we want to get these people to answer questions while we've got them. So the first question that we had about the FEMA expenses is the applicant must be a U.S. citizen and the victim also?
That's not accurate. I responded to that one in the chat, and Justin can go over. There's 3 categories that the applicant has to be part of. There's no requirement for the decedent to be any of those, except that they have had to die in the United States or a territory.
Here's the language. Thanks, Gary. So the applicant must be a U.S. citizen, non-national citizen, or qualified alien who incurred funeral expenses after January 2020. So it's also retroactive, and there's 3 different categories. The second is there is no requirement for the deceased person to have been a U.S. citizen, non-citizen national, or qualified alien. And that's just the language they're using. I do recommend people do apply, call them, and reach out to our info email if they do have questions. But calling the helpline once it's online with FEMA is the best way to do it.
You know, Maya, one of the things I'd like to add for your audience here is this is part of FEMA's individual assistance program, which is really a relationship between FEMA and the individual. The county is not allowed to register for that person, but we are allowed to support them because we are much more familiar with dealing with FEMA than they are. And so what we are going to advise people when they contact us, either by phone through 211 or through our email account on our website, is that regardless of if they think they are not eligible, they should apply. And it doesn't hurt them any, except the 5 minutes that it takes to apply over the phone. It's going to be FEMA's determination if they are not eligible or not. So that's one of the support areas that we try to help them with.
Great, thank you. And then I have another question for you. You both mentioned scams related to this particular FEMA program. Do you know of any that have been reported here in Monterey County? Also, and an apology, he's having internet trouble.
Yeah, thanks. I have not heard of any directly in Monterey County, but we got a notice from Homeland Security that nationwide there have been people that have started to receive calls already. Probably they got a list from public records of somebody that died, and they were just calling to try to get money for them to help them register. And that's not the way FEMA works. And that's one of the things that we want to make sure that people utilize us for support. We stress to them that if FEMA will not contact you, you need to call FEMA at that 800 number. FEMA will not reach out in any other way or ask for any money. This is a no-cost program out of your pocket unless you spend more than the $9,000 benefit that they're offering.
All right, thank you both. And that's all the questions that I have at this point. Gary, if you need to drop off the call, we'll forward any other additional questions, or maybe Justin, who can stay on, we'll send them to him. Thank you both.
Thank you, Maya, very much. And thank you for letting us be here to talk about this. I know that it's a little confusing because FEMA has not provided all of the information that we're looking to get. We still don't know when the phone number is going to be, but what we wanted to reassure not only our media partners, but the public that we're on top of this. We are directly communicating with the board every day on this type of situation. And as soon as we get additional information from FEMA, we will be passing it out within minutes from that to not only our media partners, but the public.
Thank you both very much.
Thank you,
and
ma'am.
now we'll turn to Dr. Moreno, who we've got on the line, who will give us an update on COVID-19 and metrics. Dr. Moreno, good afternoon.
Good afternoon, Maya. All right. So good afternoon, everyone. So at this point, on a weekly basis, we look at the California Immunization Registry to get an idea, an estimate of how many people have been vaccinated in Monterey County. As providers, vaccine providers receive vaccine and administer vaccine, they're required to enter that information into the state immunization registry. And according to the state immunization registry, at least 35% of Monterey County residents over the age of 15 have received at least one dose of vaccine. That number is probably higher because there are some healthcare providers who are still not being able to get all the vaccine doses into care, or they're getting it into care and care is not reporting on those. So at least 35% of Monterey County residents over the age of 15 have received at least one dose. And starting tomorrow in Monterey County and statewide, individuals that are 50 years of age and older will be eligible to receive the COVID vaccine. And then April 1st, all individuals 16 and over, April 15th, all individuals 16 and older will be eligible to receive the COVID vaccine. And I do encourage everyone that's eligible to be vaccinated to schedule an appointment. And if people have difficulty scheduling an appointment, or they have internet access difficulty, have difficulty maneuvering through the vaccine provider appointments, scheduling systems, to please ask a friend or a family member to help you out to schedule try to schedule those appointments, or call 211, and you can receive some assistance with 211 by 211 in scheduling appointments. Moving on to the state blueprint, the state's metrics for Monterey County as of this past Tuesday, yesterday, qualify us for the red tier. The red tier does release some restrictions on businesses, which can create additional opportunities for exposures to the virus to occur. So to keep our case rates down, which will keep our hospitalization rates down, and which will reduce the number of people dying from COVID-19, we still need to take measures to reduce transmission of COVID-19. So you've heard this before, but I don't mind saying it again. We need to continue to wear our face coverings when we're out of the house, avoid gatherings, wash our hands frequently, practice social distancing. As I mentioned, get vaccinated when you're eligible, and also get tested if you have symptoms of COVID. Get tested if you've been exposed to COVID. Get tested, or if your doctor recommends getting tested for COVID, please follow your doctor's recommendation. Let's see, there is some new state guidance that came out from the state as part of the blueprint. One of the guidance documents is on commencement ceremonies. So before this guideline came out, the state had recommended that schools follow the state guidance for drive-in theaters, drive-in movie theaters, for drive-in, drive-through graduations. Now that the guidance is out, the guidance states, and this is just highlights of the guidance document, but that in all tiers, so this includes Monterey County, the attendees, groups of attendees should be limited to household units, and audience seating should be in marked seats, and attendance is limited to school staff, graduates, household members, and family members. And particularly in red tier, these ceremonies are limited to 20% of the maximum capacity, and it is limited to in-state spectators only. But the state does also recognize that some schools may not want to bring everyone together in these settings, so they still recommend that alternatives to commencement ceremonies are still appropriate, which include virtual ceremonies, car parades, and drive-in outdoor ceremonies. Another guidance document that came out is for outdoor seated live events and performances. And for red tier, it's there's a limit to the number of audience that can participate. That limit is 20% of the capacity, and also it is also limited to in-state spectators. The organizers of these outdoor seated events must offer a weekly testing program for their staff, and the operators must also require that the people attending get advanced tickets sales, and no tickets sold at the door. And then finally, again, these are just highlights that any food concessions must be closed to people coming up to order food. And if the food and drinks are going to be consumed, that the facility must make arrangements to deliver the food to people where they're seated. So those are just some highlights on a couple of guidance documents that came out that would apply to Monterey County and particularly in the red tier. So that's it for my update, Maya.
Thank you very much, Dr. Moreno. We'll go ahead and get started with questions. This was a question in the chat, and those people who can see chat can see the answer, but those people who can't probably would like to know this. So I'm going to go ahead and ask this. This is for Kim Stemler. And the question, Kim, what is the percentage of ag employees that you estimate are hesitant to be vaccinated?
So thanks, Maya. It's actually less than was reported. And we're finding it's probably around 5 to 10%. So people might actually be saying that they're hesitant, but when they actually go with coworkers and they're signed up as a work team, there's a lot less resistance than we expected. That being said, there's still resistance, and we need to make sure that everyone is educated.
All right. Thank you, Kim. And then our next question is for you, Dr. Moreno. Dr. Moreno, are you still hopeful Monterey County will make it into the orange tier next week or next Tuesday?
Oh, okay, good question. So The state's requirements to move into a less restrictive tier is that the county meet the criteria for that less restrictive tier for 2 consecutive weeks, and those as reported by the state on Tuesdays. So yesterday we were in the red tier, so we would have to be moving forward. We'd have to have 2 consecutive weeks meeting the orange tier criteria to move into orange tier. So am I hopeful that we move into orange tier? Yes, I'm hopeful that with everything that we're doing and increased numbers of people vaccinated and other infection prevention measures, eventually we can see the case rates drop, not just here in Monterey County, but across the globe to a point where we are not as involved in the pandemic and we can begin to get back to less restrictions, which first step for us would be orange tier. So thank you.
Thank you. And the next question also for you. From April 1st to April 15th, there will be a significant increase in those eligible for the vaccine in Monterey County and, of course, around the state. As you mentioned, will you see an increase in vaccine supply locally? And how long do you think it will take to move through these groups?
I don't know that I have a specific answer for that, Maya. All I can say is that I agree that there will be a lot more people that are eligible in California, and I can also share that the state is estimating that California will progressively receive more and more vaccine through federal allocations from the 3 manufacturers of COVID-19. So we're hopeful that the demand will still be there as vaccine doses arriving in Monterey County slowly increase, and that people will take advantage of increasing supplies when they come.
Thank you. And then another question for you. How would you rate Monterey County's vaccination effort so far?
I think we have a lot of, very happy that we have a lot of participation from vaccine providers here in Monterey County. We have our hospitals, we have our primary care clinics, we have our urgent care clinics, and we have other organizations like Monterey Fire, Visiting Nurses Association, and partnerships with various employer groups such as ag and education. So I think, and in addition to that, we've got the work that the health department is doing with the, as Krista Henney and Rosemary Soto mentioned, to get information out to various communities on the importance of vaccination. So all I can say is I'm just very grateful that so many organizations have stepped up to help vaccinate Monterey County residents.
Thank you. And then another question for you. Based on yesterday's tier assignments, what is the soonest date Monterey County could enter the orange tier now?
Let's see. So Monterey County would have to, if Monterey County met the orange tier criteria on the 6th and the orange tier criteria on the 13th, the earliest we could move of April, the earliest we can move is to orange tier would be April 14th. But that would be the earliest, but it really depends on how well Monterey County residents and visitors to Monterey County continue to use face coverings and keep their distance and try to avoid situations that are where there's a higher likelihood of transmission of COVID-19.
Thank you. And then another question for you. Do you know how many doses of vaccine we are expecting in the next 2 weeks?
We don't know how much we get until we actually get our final allocation and our final approval by the state. So that information is, I don't have a number. It varies from week to week. But we do post our vaccine information on our website, and people are welcome to go back, and we update that, I believe, on every Monday.
By 5 o'clock, yes. All right, thank you. And one more question for you, Dr. Moreno. At the current vaccination rate, has the health department projected when Monterey County might reach herd immunity level?
Very good question. So actually those discussions are being led by the California Department of Public Health, and they are looking at they're looking at the vaccination rates. They're looking at also beginning, I believe, to look at prevalence data, which comes from serology testing to see what proportion of the population has antibodies to COVID-19, which would be, I think, pretty important. And so we occasionally get updates from the California Department of Public Health. And at this point, we haven't reached herd immunity, which is why we're still really doing everything we can to get vaccine into Monterey County and get vaccine to Monterey County residents. But I'm looking forward to that. I think there's still a lot we don't know, Maya, in terms of the impact of variants. I think at this point, we don't have any evidence that the Western variant has had any significant impact on transmission here in Monterey County more than the original variant. But there are other variants out there that have many more mutations that make those viruses less vulnerable to antibodies, either from natural infection or immunity from vaccines. So there's a lot we still will need to more to understand about the impact that variants could have on our efforts to reach herd immunity.
Thank you, Dr. Moreno. Another question for you. Some neighboring counties have shifted OptumServe sites to vaccination sites. With the eligibility expansion, will Monterey County do the same?
We have on a more than a weekly basis, we have conversations with our vaccine providers. And at this time, our vaccine providers are telling us that they have more capacity to vaccinate. So if they had more vaccine, they could vaccinate more people. So right now we're really looking at hoping that we get more vaccine, and when we do, be able to get this vaccine out to the providers who are really asking for the vaccine so they can vaccinate. So that's our main, I guess, strategy at this point. In terms of, I speak for public health. For public health, we do have the capacity to operate 4 or 5 large clinics with over 1,000 doses a week. I mean, a clinic, so that we also have capacity there. If we get to a point where we feel that our providers, including public health, our hospitals, our primary care providers, and other vaccine providers and pharmacies are reaching capacity, we already know that the state is willing to work with us to convert OptumServe testing sites to vaccination sites. So that is something that we're aware of. That's something that we've already had those conversations with the state, and we meet with the state on a weekly basis to talk about where we're at in terms of our ability and capacity to get vaccine out as it comes in. And we will continue to have conversations, and if the need arises, we'll start to pursue the offer from the state to create OptumServe vaccination sites.
Thank you. And another question for you. Your orange tier projections, would they be based on the state's vaccination of HPI quartile 1 as well? The threshold would shift if the state reaches 4 million vaccinations in that regard, he believes.
So I haven't made any projections on orange tier. I'm just stating that under the current metrics, that would be the earliest that we could move. There is but the question does allude to the fact that the state has a vaccine equity metric, and one of the reasons we're in red tier is because as a state, we've all met the first goal of the vaccine equity metric was to vaccinate, that 1 million doses have been administered to individuals living in Healthy Places Index 1 quartile. And thanks for the question. There is a second goal, and if we do reach that goal, we would, I think it's 2 million. Then excuse me, give me 1 second, Maya. The orange tier requirement would shift if that second goal is met. So right now, to get into orange tier, the adjusted case rate needs to be between 1 and 3.9 cases per 100,000. And if the second goal is met, then the adjusted case rate requirement for orange tier would shift to a case rate of 2 to 5.9. And if that happens, it would be we wouldn't have to have as low of a case rate to get into the orange tier. So I don't know when that's going to happen. I hope it happens. Hope it happens soon, because it would mean that more people living in HPI quartile 1 have been vaccinated, which would be wonderful. But yeah, I don't know when that's going to happen. So the way things stand, we would still need to be in orange tier for 2 weeks before we can move to orange tier.
Thank you, Dr. Moreno. That's all the questions that I have in chat right now. Are there any additional questions for any of our presenters? Seeing none, that will wrap up the briefing for today. Thanks very much for joining us. We'll see you next week.